In the largest survey of health care ever, 92% of Canadians say they like their doctors so much they would recommend them to family or friends. In Canada, primary health care physicians are basically family doctors and handle everything through a private practice: physical, mental health, maternity, pediatrics, geriatrics, says an author of 18 books on Canadian health law.
This is not socialized medicine. The government does not provide doctors, does not provide hospitals. You go to whatever doctor you want, just as you do here, and doctors can either take more patients or not take patients. It's up to them. And the same is true with hospitals.
All Canadians have health coverage through the government. 70% of health care is publicly funded and 30% is privately funded. Each province runs its own health care budget, although the federal government supplements some provinces that are not as prosperous as others. It is a very cost-effective system, only 10% of GDP compared to nearly 16% of the U.S. economy. And Canada only spends some $3,895 per person a year. That's about half of the expenditure for the average person in the United States.
Thank you. Germany has two strands of health insurance, public and private.
Here? You can put it
up, all the way to the top?
Yes. Okay.
Under any plan, visits like My Routine Physical with Dr. Pshivara are covered.
They are treated, doesn't matter if they're private or they are normal patients.
Universal health care. Germany has one of the oldest systems in the world. Founded in 1883 by the first German Chancellor Otto von Bismarck, with a principle that remains unchanged till today. Everyone must be covered, and ideally, everyone should get equal treatment. Most Germans are insured under the public plan, which is not funded by taxes. Employees pay half the premium, while employers pay the other half, to insurance companies that are heavily regulated by the government. Here at Berlin's Charité Hospital, the director says that means world-class health care for everyone.
If you go to the emergency room or if you go to an outpatient doctor, you can get as a child vaccination and as an adult liver transplant without difference between people.
And Dr. Frey says even with universal health care, the cost per patient is lower in Germany than in the U.S.
How does health care work in Cuba? It's not an easy question to answer, but there are some impressive statistics. According to the World Health Organization, Cuba's life expectancy is 78 years, the same as Chile and Costa Rica, and the highest in Latin America. And its infant mortality rates are the lowest in the hemisphere, in line with those of Canada. This clinic in Managua, a community outside Havana, is one of the country's newest and best equipped. It serves a population of some 15,000 people. The director tells us under one roof she has dentists, general practitioners, physical therapy, homeopathic medicine, and a laboratory that makes vaccines.
Built just 5 years ago, this clinic is really a symbol of what Cuba wants to do with healthcare all over the country. You can see the machinery is new, the walls freshly painted. It's an idea of where the country wants to go, the future of its healthcare.
All of it free of charge. How does Cuba do it? First of all, the government dictates salaries. Doctors earn less than $30 per month, very little compared to doctors elsewhere. And priority is given to avoiding expensive procedures, says Gail Reed, who's lived and worked in Cuba for decades.
They concentrate on prevention.
They queue long before dawn to get health care at a free clinic in Virginia run by volunteers. Just a few of the 46 million people in America without health insurance.
It blows my mind how many people are here who really don't have medical care.
The United States spends far more than any other country on health care. In real numbers, $7,062 per person in 2006, about double the European average. But just 5% of Americans are responsible for very nearly half the money spent on health care, while half the population spend between them just 3%. The United States faces the same problems as other developed countries, an aging population and the exploding cost of medical technology, but has no tradition of publicly provided universal health care. Most Americans pay insurance premiums, often through their employer, to commercial health care providers, who then negotiate with doctors and hospitals. And those premiums have risen much faster than inflation or wages in the last decade.
As an insurance agent for 35 years, I love the business because it rewarded you for the effort. Over the years of my career, I saw the coverage get more expensive, but you got less. Here's my tax return from 2002. Our medical expense that year, a month, was $960. Now I go to 2007, and the cost came out to $1,990 a month. That's almost $24,000 that year, because we could no longer afford that kind of cost. We did the unthinkable. We dropped our insurance.
It's a little scary not to go to the doctor when you think maybe, well, I should have this check.
But we finally got her coverage. It was around $500 a month. Not a very good plan.
And still today, with changing my deductibles, higher deductibles every year, and still the cost keeps going up.
Insurance, I cannot even get prescriptions that I'm supposed to take every single day. I've got doctor's orders right now for different tests that I can't do because there's no way to cover it. You know, we're making ourselves here with the business trying to just stay above float, and it's like the water's at the nose. That's how close it is. So we don't know where to turn. We don't know what to do. These are the Asacols. They're 400 milligrams each. These are $450 to $500 a month, depending on where you go. None less than $450 anywhere, except for Canada. I'm supposed to take 12 a day, and this keeps my Crohn's under control.
With her having Crohn's disease, it does make it impossible for us to buy insurance that covers anything.
It's voodoo. It's like Crohn's is voodoo. They don't want to touch it. It's pre-existing.